And today, as we really are framing, right, that we really hope that you walk away with the real charge that now is the time to forge new and innovative partnerships between expanded learning and schools with health and human services, mental health, substance use intervention and treatment to provide our children, youth, and families with what they need to thrive and also what they need to address critical situations that they're going through. We hope that you'll see that county offices of education and the system of support for expanded learning are viable partners and viable places for partnership to sort of help those types of partnerships happen on a more systemic level, and that this is a viable partnership that can also happen with local education agencies or community-based organizations to influence the types of supports that we can offer children and families on the ground in the types of capacities that the staff of expanded learning programs have. So that's what we'll be doing today. There's another slide that also outlines our webinar objectives. I think I basically just paraphrased what those objectives are. So really one of the things that I want to begin with is to talk with two levels of state leadership. One, we're going to have some leaders from the California Institute of Behavioral Health Solutions and Advocates for Human Potential that work a lot in the mental health intervention and substance use intervention and treatment space to talk about sort of some of their experience on that level of the statewide system, and then get the chance to also hear from Sarah Neville Morgan, Deputy Superintendent of the Opportunities for All branch at the California Department of Ed, to really get a statewide perspective on the work. So I'd like to, at this time now, welcome Elizabeth Salazar and Luis Nieto to share a little bit about some of what they're experiencing at the statewide level. So I believe I'm first going to just turn it over to you, Luis.
Yes, thank you so much, Jeff. It's exciting to be here this morning. My name is Luis Nieto. I am the director for the Youth Opioid Response at AHP, also known as Your California. This program seeks to strengthen capacity and access to prevention, treatment, and recovery services, as well as access points to medication-assisted treatment for youth in California. Our program is funded by the California Department of Healthcare Services, DHCS, and our Your team is comprised of California Institute for Behavioral Health Solutions, CIBHS, in partnership with us, Advocates for Human Potential, to provide grant administration, training, and technical assistance to support our Your grantees as they build and improve access to MAT and other treatment and recovery support services throughout California. Currently, our Your California team contracts with and supports 40 organizations across the state as they do their good work every day. They are about 3/4 of the way through their grant and have done amazing work, but I have also seen a lot. I'm also pleased to introduce Elizabeth, or Liz as she's known or goes by, but she can speak more to what we've been seeing and what the reality is for youth and families who our grantees have been working with that are in very much need of support and prevention services. So I'll hand it over to you, Liz, so you can take on the meat of what's going on and what we're seeing.
Thank you, Louise. Thank you, Jeff, for hosting all of this today. So we can have the next slide, please. My name is Liz Stanley Salazar. As you saw, I've been in the field. I'll just introduce myself briefly. I was started out as a public health nurse and then moved into public health administration And I've been working in the field in this state for almost 40 years. And my heart breaks every day to the trauma and suffering and struggles of individuals suffering with substance use disorder and mental health disorders, and their families and the people who care about them. And I want to make a point going into this, that overdose crisis, we talk about it, we talk about it in this distant kind of way. It is national, yes, and there are statistics, but its impact is very, very personal. And not only personal on individuals who lose loved ones or people that they have been struggling with to help, or any of those circumstances, they are many. But the impact is personal on the workforce. The impact is personal on the people who suit up every day and go out into our communities to help others. And it is a public health crisis. Next slide, please. I do want to make a point, though, that the crisis is changing, and it's not one crisis. It's not the overdose crisis. This is multiple layers of crises and public health crises that we are experiencing in our community. So I want to just give you some facts to focus in on this issue of fentanyl. The entire landscape of overdose and how it's occurring has changed in the last 2 years. The landscape of drug use has changed in the last 2 years. Schools are infiltrated with drugs in a way that they have not been infiltrated in the past. And so there's so many changes that are going on, and we struggle to keep up with it, to be honest, because we still are using tried and true efforts. And frankly, I'll get to it in a minute. What also contributes to it is the fragmentation and the underfunding of our efforts over the past many years, although this is changing. But right now, just as this is from a CDC report, and as you know, overall, if you read the Monitoring the Future reports for substance use amongst adolescents and teens, and even middle school children, use is declining. So use itself is declining in middle school children, in teens, but the overdose crisis has hit this population extremely hard in the last 2 years. And the increase was 109%, and that's in children or young adults ages 10 to 19. And the deaths that are occurring involve what's now called illicitly manufactured fentanyl. And just focusing on fentanyl is no longer the best practice, because there are other synthetics that are coming down the pike right behind fentanyl, and this pattern will continue. This is this change in landscape, and this has increased 182%. 90% of the overdose deaths amongst this age group specifically involved opioids, and 84% of those were laced with IMFs. Only 35% of the decedents had documented opioid use history. They were not heroin users. They were not opioid addicts, if we want to call them addicts, and we should not. They were in fact not using opioids. Counterfeit pill evidence was present in 25% of all the overdose deaths. 2/3 of the decedents had one or more potential bystanders present, but most provided no overdose response. 60% of the overdose deaths occurred at the decedent's home. 60%, almost 60%, had no pulse when the first responders arrived. So the individuals, the bystanders around them, obviously don't know what to do, are in shock themselves, are left without any tools. And this is a pattern we're seeing not only in youth, but in adults as well. And 41% of the decedents had evidence of mental health condition and were in treatment. However, that means 60% did not. Next slide, please. So what's contributing to these alarming numbers? Well, first of all, the availability of fentanyl, high potency drugs like fentanyl, like xylazine themselves. I think we have to step back and look at how information is shared. And we all know we're working with youth. We all talk about social media. We all talk about TikTok. Yes, yes. And information and marketing is now widely available, and it's all via social media. And the accuracy of that information and the messages are not necessarily wholesome, well, or accurate. The manufacture and availability of counterfeit pills with IMF themselves is off the chart. As you see, you find the IMF in many drugs that are tested by the DEA. And not to say the least of the issues and public health crises, which I won't go into, you're all aware of it. Since COVID, we have a mental health crisis among adolescents in this state, and it's been well documented. We have fragmented, siloed, confusing responsibilities and pathways and systems. And there's the opportunity to change that. There's the funding to change that. There's the intention to change that. But we're starting where we're starting. And we have to recognize those challenges from the starting point. And I will also, having been in the field for as long as I have been, this is not an attack on silos. Silos were very useful for many, many years. This is how we received funding from the federal government. We had a mental health silo. We had a substance use silo. But we actually benefited from it, but the complexity of perhaps cases, the complexity of needs, the underservice to many populations has just skyrocketed, and this fragmentations and these silos no longer serve us. And then we can't overlook the fact that there's denial, stigma, and discrimination. Next slide, please. So again, just what's the challenge and what are the efforts? So let's look at schools and after-school programs in the age of the overdose crisis. We've established there's a crisis, there's an urgent need, there's an urgent effort that's needed. And we still see in many, many schools that students caught with illegal drugs at school are faced with sanctions and consequences such as expulsion and suspension, and in some cases, even possibly a criminal charge. But the parents, the teachers, the individuals in the community are calling for better practices, different changes, evidence-based efforts, and still others are not. So we're caught in between, we're caught in the middle, trying to listen to our community, listen to parents, and develop practices that are in the best intention for the youth and for the well-being of the youth. So anyway, very specifically, I don't have to go into why we need collaboration. We're going to be speaking about it for the next 30, 40, 50 minutes. We do need an integrated approach to behavioral health. It's outdated, it's useless, and it continues. Expanding efforts focus on resilience and connectedness of adolescents to prevent substance misuse and related harms. This is your wheelhouse in education. We in the substance use delivery field particularly need to learn from you how to do this better, because we have adopted many adult models of programming and apply them to adolescents. And we all know, and research shows us, that change occurs by expanding efforts focused on resilience and connectedness. We need student-driven and peer support activities to blossom, give youth a voice, give youth a role in this activity, and they want it. We need to increase education and open discussion regarding the IMFs and counterfeit pills for everyone, for administrators, teachers, counselors, students, and most of all, parents. Schools need to stock naloxone and expand naloxone training and access. We have both ends of the spectrum going on in the state. In LA Unified, the superintendent has taken a rehabilitative approach and has integrated naloxone in response to overdose on campus. They've removed the sanctions in LA Unified, and they are taking a full-on, as I said, rehabilitation approach. They are not expelling students. On the other end, there are a pathway and activities that have to occur, but they're not expelling students. On the other end, I know of school districts that have naloxone locked up in the cabinet and are not distributing it. and they're not training the staff to distribute it. And then I also know of schools that refuse to have it on campus as well. We have to ensure connection to treatment for substance use and mental health disorders when present. This is the major body of work that's being done right now by the Department of Education, by every LEA, by every school office of education in the state. How do we do this? We have the mandate now, we have the vision, we have some funding, but this is an enormous effort and change effort that we all know is going to be long in coming and take a lot of work and coordination and collaboration. Next slide, please. I just want to end, saying all that, and that's enough said. There are many, many, many resources available. The number of resources just in the past 12 months that have come into our space is just phenomenal. You'll get them all as links in the facilitator's guide. And again, last year, California passed the campus opioid response, Campus Opioid Safety Act. And college campuses now are mandated to provide naloxone and training and education about this. We see right now there's at least 5 bills in the legislature that will remove expulsion and those sorts of consequences. There is one AB 2998 that will actually authorize a minor to consent to receiving and carry and administer the naloxone themselves. So there are many activities going on in this area and addressing some of the policy barriers that have existed, and will also allow those who want to pursue these public health efforts to pursue them because they will be codified. This is a beautiful resource for parents, and it's the new Drug Talk, a song for Charlie. And I think that's one of the most important things we can do, because we as administrators can do our work and managers and struggle and want to have best practices and want to implement them. But we have to educate our workforce and our communities extensively, parents, law enforcement, about these issues. And it's incumbent upon all of us to engage in one form or fashion of that. So thank you very much for your attention. And I'm turning this back to Jeff.
Thank you, Louise and Elizabeth. And what I really heard is that we are in the midst of a crisis, and it's important for us to be educated about that crisis and how to address it on a spectrum where we can really create the conditions for thriving and promote resiliency in our programs. There's also the access that folks need to mental health interventions, and the understanding on how to address this crisis by educating kids and families, but also by building capacity of our own staff and reducing the stigma and increasing access to naloxone. I also want to highlight that I've just learned of legislation being moved by the California Alliance to shift how schools intervene when they experience substance use in their students, to take a more public health approach as opposed to suspensions, right? So it seems like things are moving in that way. But really, one of the things that came, and we'll be able to hear of some of other efforts to engage families and do this on the ground at a program level further down the road in this webinar. But really what I heard was, now is the time for increased integration of all of us across the spectrum. And I want to invite Sarah Neville Morgan from the California Department of Education to just come and share with us from a state level really why there's never been a better time to sort of forge these partnerships across multiple systems to support kids and families in our communities. So I'll turn it over to you, Sarah.
Thanks so much, Jeff. And you are so right. I think you actually captured everything I was going to say perfectly. So good morning, everybody. Thank you so much for joining us today. And I hope you all enjoyed that the way that Jeff brought us into this space and really trying to model that, I think, in all of our programs and with all of our students and teachers and staff. So truly, this is a moment in time that we have not seen before, fueled by a powerful vision on transforming California's schools to best support today's students, families, schools, and communities. Not how it looked when it started, not in 1950, not even in 2019, but really what do our schools and our students and families need now, along with historic investments. California's education system is truly undergoing a transformation. One critical component that this transformation seeks to ensure is improved outcomes and results, that all students are supported for long-term success in college, career, and life. Along with this focus on student success comes a growing awareness and a commitment to address the whole child, our students' physical, social, and emotional needs, along with other barriers to learning that the two speakers before me really brought up and made more visible. These transformative investments center schools within their communities and requires diverse partnerships at both the systems level and at the local level. Additionally, these investments have taken California's expanded learning system to an entirely new level, with an additional nearly 700 local education agencies participating and funding growing from around 800 million to nearly 5 billion. For those of you who follow the budget, our legislatures say, oh, when it's an M, we don't pay as much attention. But once we get the B in the billion, they start to pay attention to the agenda items. So 5 billion, you all. Now, more than ever, the education system and our schools seek partnerships to advance their expanded learning, their universal pre-K, and their community school efforts. Partnerships with health, with mental health and substance use prevention, with intervention and treatment are relevant, more than relevant. They're desired and critical in schools. We cannot achieve California's vision without them. As we dive deeper in this work, thinking of prevention and early intervention is also critical. We know high quality expanded learning programs with their responsive relationships at the heart of everything they do can help mitigate other adverse childhood experiences or ACEs and serve as a way to reduce, prevent, and address behavioral and mental health and other public health concerns. And truly, that mention of our staff, our educators needing more and more training in this space is so key. This system and these programs create a flexible avenue for partnerships to support our students' physical, social, and emotional wellness all day, each and every day, and all year, and forward into their lives. Today, we will all lean in together to learn more about the system, how it can be, and how it is being leveraged and partnered with to support California's bold vision and help us achieve the results of thriving students with a lifetime of success ahead of them. So I'm going to hand it back over to you, Jeff, for the real work.
And thank you so much, Sarah, for sharing with us this bold vision at the state level, right? We understand now from both of our statewide speakers that now is the time. And not only is this relevant, it's desired more than ever to create these state, regional, and local level partnerships. I just want to provide a little bit of historical context as well, because the expanded learning field has been really exploring this concept for more than 5 years, but really I'll talk about the last 5 years. But first, for some of you, you might be wondering, what is an expanded learning program? So an expanded learning program happens before school, after school, summer, or intersession, right? Anytime that school is not in session. But its focus is really about developing this academic, social, emotional, and physical wellness within students, which makes them a real unique partner for advancing the types of efforts that we're talking about today. Also, one of the elements of expanded learning is that community partners are encouraged and desired In fact, one of our quality standards is collaborative partnerships. So expanded learning programs are a great sort of place to begin. Let's take a look at the next slide that talks about that investment, right? So before the pandemic, expanded learning programs were invested at close to $1 billion, with that sort of orange, that orange piece over there on the left. Now, those orange investments are after-school education and safety and 21st century community learning centers are still in place, along with the $4 billion of investment in the new Expanded Learning Opportunities Program. So again, now more than ever, expanded learning programs are happening in every community, and so create a scalable and system level sort of opportunity for partnership. On the next slide, we'll kind of get a look at a little bit of our history. So in 2004, Bonnie Bernard released a text called Resiliency, What We Have Learned. And that was before the great after-school education and safety expansion of 2006. And in that text, on the next slide, you'll see that she outlines that when children and youth experience caring relationships, high expectations, and opportunities for meaningful participation, these meet the developmental needs, promoting strengths that result in life success. Years later, in 2019, 15 years later, the National Aspen Commission on Social, Emotional, and Academic Development came together and also did a new review of research, including neuroscience research. And in that research, you see really the same sort of framework, that this caring relationships, high expectations, and opportunities for meaningful participation result in life success. What I really love about this model is they talk about safe, equitable, and identity affirming environments as well, where children and youth have a lot of engagement, ownership, and purpose. And these are the foundation of California's quality standards for expanded learning in California, where we have safe and supportive environments, rich with youth voice, active and engaged learning, skill building that are welcome and accessible for all. And what we sort of say in shorthand for all of this research is that love is a research-based approach. And we know that programs are creating this condition for thriving and resiliency. But in 2019, we started to think about, because we're serving those folks with critical need, what would it look like to increase health, mental health, substance use intervention and treatment partnerships, nutrition programs, right? Like access to healthcare. And we brought together over 100 multi-sector stakeholders to create a statement of strategic direction toward equity-driven whole child health and wellness. We started this work in 2019 and developed it through the pandemic. And really the essence of the feedback was that we really need to sort of stop and take stock of exactly what our systems have been designed to do and how they've been designed and what has been their impact. And we really need to, based on that examination, really look at how we then center our systems. And this is on the next slide, how we center our systems on our kids and families, how we make sure that we have a well-equipped and networked adult workforce to collaborate across systems and leverage resources. One of the recommendations that came out of that work is really to think about the system of support for expanded learning in California's system of support, which is also centered in county offices of education and supporting districts in many ways. and really looking at the county as a nexus of collaboration. Within these county systems, there are 16 county offices of education in California that house the system of support for expanded learning. And those county-based technical assistance providers cover the entire state. So we're now about to hear from Nora Hanna, who is with San Joaquin County Office of Ed, to talk a little bit about the work that happens in the county. And Nora, the question for you is, right, we know that county offices of education play a strong role in supporting local school districts and the children, youth, and families that they serve with prevention, intervention, and access to services, including substance use intervention and treatment services. Can you talk to the work that you do at San Joaquin County Office of Ed and why it would be important for the health, mental health, and substance use intervention and treatment community to outreach to local county offices of education?
Thank you, Jeff. It's a pleasure to be here with everyone. I am honored to actually have been thought of as somebody to speak to this. A little bit about me and what I do. My role here at the county office is one that kind of embraces prevention programming and really looks at the whole child in different ways that we can incorporate learning into our school districts. My background is I have a bachelor's in developmental psychology. I'm a school counselor, and I'm also a certified youth mental health specialist. So looking at different ways to incorporate effective learning strategies for students is as part of my wheelhouse. So it naturally fit. I've also been part of the expanded learning field for a very long time. That's how I started at the county office, and have built a team to be able to help us do some of the work that we're doing here. Sorry, sounds like I'm having some audio issues. Can you hear me okay now?
Yes.
We can hear you,
Okay.
Nora.
Perfect. Sorry about that. So next slide, please. Some of the things that is really important when thinking about your county office is what they are scaled to do. County offices, you know, we have 58 county offices, and each one has a little bit of a different strategy on how they support their school districts. But one of the main overarching goals is to provide technical assistance and be service oriented. Here at the San Joaquin County office, our strategic plan is called Building to Serve, where we have 5 pillars where we're showing how we serve. And one of those pillars that really stands out in this lens is our exemplary support and services for our school districts. We have the ability to leverage different resources for districts, apply for funding for districts that are smaller and may not have the infrastructure to do that, and also be able to support them through different lenses. Okay, I'm going to try this again in a different way. Okay, can you hear me?
Yes.
Hello, can everyone hear me? Okay, perfect. All right, don't know what happened, but I'm just gonna do it this way, make sure everyone can hear well. So we have opportunities to provide trainings. We have opportunities to leverage different types of trainings that may not be as easy for a district to pull out on their own. One example is we've been doing brief intervention trainings for districts. We've held 5 of them this year. If a district were to do that on their own, it would cost each participant $125 minimum to be able to go through the training. In order for us to do it, we pay for it on our end, and we will really be able to build the capacity of the district by sending certain people to the training and not have to spend that money on their side. Another example is our naloxone and fentanyl town hall partnerships. So we were able to, at the county level, build a way to be able to help districts get naloxone on their campus and be able to do some of the things that they needed to be able to build the infrastructure, have the policy go in place by doing it at the county level and then showing them an example of how to build that at the district level. We also have been able to successfully for the last 2 years hold fentanyl town halls with partnerships from public health and behavioral health and be able to leverage those resources for districts and be able to have districts send their staff to some of these trainings or else even promote it at the community level for their parents to attend these trainings as well. Next slide, please. So currently, some of the partnerships that we have is I sit on an opioid task force for our county with public health, which gives them a lens of what schools are doing and be able to give them some information on how they can support our districts, what kinds of ways we can bring things back to our districts, what kinds of things are maybe a little tricky for schools to be able to do and need a little bit more support in. We also partnered with our behavioral health department here at the county, and they turned over all their substance abuse block grant funding to our county office to distribute to school districts and be able to support school districts with both Friday Night Live and substance use disorder programming and be able to kind of build the capacity of the districts. We've been able to partner with our county public health department, like I said, and we are one of the 10 organizations that were awarded funding to be able, through the Department of Healthcare Services, to be able to launch a focus on families in crisis prevention and be able to leverage some resources for our county and then look at what that looks like at a state level. We also house the statewide California Healthy Kids Resource Center, which is a lending library that's been in existence for a long time. And this is through networking and partnership at the state level that we were able to do. And also we're working with our Family Justice Center to be able to bring additional resources to schools that they may have funding to do, but they don't have the capacity to manage at a district level and be able to work with each district. So they bring that to county office, and then county office helps to disseminate some of that. Next slide. So how to do this, where to get started? I would say look at what your departments are at your county office. What are your departments in your county office? Go onto their website, look and see if there's a prevention department, look and see if there's nursing services, look and see if there's mental health services. Is there positive behavior support services? Is there a continuous improvement and support department? And if there are those people, tap into those people, look and see what you can be a part of. Even if it's joining a listserv for trainings, most of the trainings they have will be beneficial to all school districts, all personnel, and they will have a capacity to be able to tell you what level, how much it'll cost. Maybe there is no cost because they have a grant that supports that. But there's a lot of different opportunities to be able to take advantage of. Next slide. So here's some of the effective program partnerships. There's a lot of benefits, adding supports for students. And when we do this, we always look at our expanded learning field to be able to know what their needs are. So for instance, when we started looking at focus as being part of our county offered services, one of the first things that I asked is, how are we going to include our expanded learning programs in this? Are they going to get notifications of students that are in crisis when the need occurs, and what can we do to help them be part of this conversation, be part of that whole child need, and look at leverages of funding and different ways to have funding. Some of the partners to include are on here: county public health, county behavioral health. Your public health department has lots of different needs. They have different funding opportunities. They have different ways that they want to tap into students and youth and be able to fulfill some of their strategic plans for the county. Tap into those folks and make sure that you really understand what they have available and how you can be able to partner with them, even if it's through the county office. Look at your workforce partners. Who's out there that needs some additional work folks? Like, for instance, right now there's a huge push for clinicians and counselors in school districts. How can I partner with some of the workforce partners to be able to provide some of those services in our schools? Elected officials have agendas. I know for our county, some of our elected officials really want to get cannabis education, fentanyl education in the hands of the districts, but they are not the ones that are able to do that. So they partner with us to be able to leverage that and be able to take that back to school districts. Your Family Justice Center, all of these hospitals, there's so many organizations that really can be beneficial, and they usually will go to one person because that's their way of getting the dissemination of information out as quickly as possible. Next slide. So in addition, if you have any questions, concerns, or ways that you want to partner, please let me know. I'm happy to help at any given time. Like I said, the California Healthy Resource Center is a great tool to be able to use statewide. And then there were some information that we put in the chat on what our fentanyl town hall looks like and other resources that you can tap into. Another really great resource, just so you know, is the California Health Framework, which is a health education hub that really looks at ways that you can incorporate some of these learning strategies as well into different programs.
Thank you, Nora. Just so rich. And, you know, I know that so many of these frameworks, right? We had shared briefly the quality standards for expanded learning in California. And, right, there's just such a clear line, right, with substance use prevention, suicide prevention, right, promoting health, wellness, resilience, right? It's really so many clear linkages to the quality standards for expanded learning in California. So a lot of shared vision represented in all those artifacts as well. So thank you for sharing with us, right, like how we can think of a county office of education partnership. And as I'd sort of shared, 16 county offices within the 58 counties also house the system of support for expanded learning. And so I'd like to sort of welcome 4 representatives of that system that cover the entire state. So these are leaders that provide support across counties in a region, and all 16 of those counties add up to coverage for the entire state. So I'm wanting to just sort of welcome Shamia Sandals, Mark Drews, Josh Blecka, and Ernesto Duran, who are leaders in this system. And we'll start with Shamia, who's in Region 4 and represents sort of generally the Bay Area community. And Shamia, 16 county offices of education house the system of support for expanded learning. We lovingly call it the SSEL because we all need more acronyms. This system covers the entire state. Can you describe how the SSEL can promote innovation, broker resources, and build capacity of local programs to address emerging community needs?
Thank you, Jeff. Thank you for inviting me to be part of this conversation. So as we heard with Nora, that COEs operate differently, and I have to say the same for the SSEL. So what I will be sharing will be specific to Region 4. I am situated in the Alameda County Office of Education, but we also serve Contra Costa, Marin, Napa, Solano, San Francisco, and San Mateo. So yes, the Bay Area. And I would urge everyone on this call to find their own system of support lead. So no matter where you are in the state of California, if you are serving students using state or federal dollars through expanded learning, you have a system of support lead. So please find them. But I'll share what we're doing in the Bay Area. So as a regional lead, we've created partnerships with other COEs in our region. This allows us to elevate the local knowledge the COEs have about their districts and charters, as well as their communities. Also, we heard that COEs are structured differently and may have specific resources or expertise that can be leveraged in different spaces to support expanded learning. At the district and charter level, our innovation has consisted of creating new ways of sharing information that is responsive to the changing legislation, as well as meeting the needs of those implementing expanded learning at the school sites. As an example, our region holds district network meetings, roughly monthly, maybe 10 or so, maybe less a year. And at these meetings, they're open to any district or charter that is receiving state or federal dollars to implement an expanded learning program. So we share the legislative updates, we have CDE contacts, and we share all the relevant information that we have at the moment to make sure they have a high quality program. However, we realized that this information wasn't necessarily translating to a capacity building for those at the school sites. So we created a network exclusively for site coordinators and those program leaders that are implementing these legislative requirements at their school sites. We also heard that LEAs or districts or charters that may be new to expanded learning. This is the first time they've ever received state or federal funding through the Expanded Learning Opportunities Program. And they had specific questions that were not necessarily being addressed in other spaces. So we created a collaborative for those specific districts and charters who have never implemented an expanded learning program before ELO or Expanded Learning Opportunities Program funding. So these are examples of innovative spaces where high levels of collaboration can happen that increases the capacity of the COE, the district, the charters, and the school sites to better serve the well-being and health of our students, to serve and meet the needs of the whole child.
Excellent. Thank you, Shamia. And I think that's really a clear illustration of how the SSEL, right, supports districts, charters, and expanded learning professionals with specific opportunities for capacity building, brokering of resources, and partnerships. So can really work on the system level within a region. And sort of speaking of this sort of system level integration, I want to ask Josh Blecka, as part of the movement for transforming schools and as part of California's goals to integrate sectors and services for kids and families, you've begun forging partnerships with community schools and other education systems and the community. And this bridge building that you've been doing has resulted in stronger partnership and increased access to interventions for kids and families based on their community's needs. Can you share more about the opportunity you see to align across multiple initiatives to support kids and families in your region?
Yeah. Thanks, Jeff. Thanks for allowing the Central Valley to be represented. Shamia, shout out to the Bay Area. That is where I'm from, but now currently reside in the Central Valley. I wanted to get on here and give it like a bunch of information, but I think I'm just going to go story form because I think people appreciate a good story. So was made aware of community schools because if you guys remember that transforming schools wheel that Ken just showed, expanded learning is represented on there. Community schools is represented on there. Well, when ELO-P first dropped, Ed Code mentioned that as part of the system of support that we had to provide technical assistance around community schools. So I made it a priority to learn what community schools was, even dressed up as Elmo at a conference Shamia was in that workshop as well. We had a full set to educate folks on community schools, because I'm a believer when it comes to expanded learning. Oftentimes we're the last ones invited to the table. So it takes us to be able to educate ourselves to be able to have a productive conversation with another education system. So from that point forward, created a relationship with our regional technical assistance center. I think they've rebranded to Transforming Assistance Centers, but in our area, we host a technical assistance opportunity called Region 7 Collaboratives. And it started out as this opportunity for decision makers in expanded learning, these high-level leaders, these ones that are the vision creators, to learn specifically what is required when it comes to expanded learning. Because I believe if someone knows the compliance, the minimum state expectation, they can use that as a springboard for innovation. But what I quickly realized in my role is that a lot of these administrators do not just wear one singular hat. They have multiple hats. One individual in particular I think of right now, they have 12 hats. And when you are wearing so many hats, how can you truly understand or take on the responsibility and the understanding of like those specific other education systems? So that opportunity that I mentioned, the collaborative, what we prioritized was inviting other systems to educate our expanded learning professionals so that they can understand those complementary education systems and how those systems can impact expanded learning. But also, I was also inviting them so that they can learn about what expanded learning can do for them. So one of the first partnerships we created was with community schools, because if folks don't know, community schools is one of the 7 state initiatives. It's a heavily funded grant, but also one of the 4 pillars is expanded learning. And for me, what I educated our administrative level positions was, hey, let's learn about this system, because we all know that some of these services are going to be provided between 3 to 6, which is usually the most flexible time on a campus. So instead of people telling expanded learning what to do, we can share how we can support those systems in that duration of time so that it runs smoothly and effectively for our parents and our families. The other thing that should be known about community schools is community schools, they're required to do a needs assessment as part of the grant funding. So if we know what the community needs, we can address it. And if we know how those other education systems can be responsive to those community needs, and we can all come together to address those needs, I believe that's literally why we're on this webinar right now, to create not one system, but think of it as like I use the analogy like a respiratory system. The heart has a role, the lungs have a role in that system. But without one or the other, it doesn't work. But I think as part of the education system and community systems, if we can have a general understanding, a general knowledge around what those roles are, that's when we can truly be co-creators. Because I believe this too. If we ask all the education systems that exist, how can you help a kid? You're going to get a bunch of different answers. But I guarantee you, those same people answering those questions, if they heard how community schools would address it, or how expanded learning would, or how early ed or migrant education or the early math initiative or dyslexia, if we had all those systems come together and be able to talk about how can we support kids and families, that is a powerful movement. And I'll give you an example. I am partnering with my community schools RTAC to host a one-of-a-kind event. It's called All Systems Go. It's literally an event that's bringing all those systems together that can impact a kid's life through their academic and their social development, and families to come together to educate any administrative level position, any family, any community partner on what it is our systems actually do. And to me, there's nothing more powerful than when people of complementary systems come together to be able to change the world. To me, that is it. I will also say this: each community schools has a community schools coordinator. So if you are local and you're a community partner and you want to be a part of this change, and you want to provide services within a district, contact the community schools coordinator. They're the one that's going to be able to tell you, is there a need or is there not, because they've done that needs assessment. I will also say this: expanded learning too, as part of our role, we are pushing our site leads, our site coordinators to be on these community schools advisory boards, to be able to contribute at site level to say, we can help, we can help.
Thank you, Josh. And, it's clear to me, right, that this systems level integration work with expanded learning, it really takes awareness building, relationship building, creating the space to understand the complexity and the requirements across systems, and really planning together on how to collaborate and how to integrate supports for kids and families. Most importantly, taking away from you that we are stronger when we work together. Mark, I want to turn my attention to you and discuss a little bit about school-based mental health in and out of school. And school-based mental health is a major priority in the Sacramento County Office of Ed, and that, of course, does not mean that it's without its challenges. And I'm wondering if you can just share a little bit about Sacramento County Office of Ed, or SCOE's, commitment to schools as centers of wellness, and how some in your community are amplifying that goal through partnership with expanded learning.
No, thank you, Jeff. Thank you for the opportunity to be here today. Just want to preface that brevity and I are not friends, so I'll try to be concise here in the time that's allotted. But the theme of our work is strengthening strategic coherence. And as a whole, the statewide system of support for expanded learning works on a daily basis to align our efforts with those of our instructional day colleagues to help ensure that sort of seamless sort of continuum of care for the child. Currently here at the Sacramento County Office of Education, Executive Director Dr. Chris Williams and Director Marcela Rodriguez are spearheading this collaborative effort to transform schools into centers of wellness, working with 13 local LEAs here in Sacramento County to help meet the mental health and wellness needs of the students. The primary goal is to house on each campus in Sacramento County that school-based mental health and wellness clinician employed by SCOE. It's a Herculean effort right now. They're at 60 sites. The goal is to get north of 300 practitioners at all sites in those 13 LEAs. But what we were finding out, the team and I, the Region 3 team, Athena McQuarrie, Corey Ovi, and I, as we went out to these sites and spoke with the grant manager, the site coordinators, are you aware of these clinicians that are on site? They looked at us perplexed. Like, who are you speaking about? So we saw that there was a disconnect. So we went back to Dr. Williams, Marcel, and we talked about, let's go ahead and map out where these clinicians are, and are there federally or state funded expanded learning programs at, and can we collect that contact information to begin that process of knowing who's on campus and the roles and responsibilities and that they all play, and sort of, in this ecosystem of transforming schools into centers of wellness. So that was like our first sort of a goal, and that's what we've done to date. But to build a foundational understanding of schools as a center of wellness, we leaned back to Dr. Williams and Marcella to go ahead and conduct these sort of informative sessions outlining the role of these on-site clinicians, the family navigator, the intern clinician, and the importance of nurturing protective factors within schools, and highlighting that integral role of expanded learning practitioners and their role within this ecosystem of schools as being centers of wellness. But knowing that the information doesn't come just from the top down, but also comes from the field, we're co-creating this sort of reciprocal learning ecosystem so that we can exchange knowledge of promising practices that are working outside of this initiative right now. So we looked at, what's happening locally. Folsom Cordova Unified, Marie Pollock, the grant manager for the expanded learning programs in Folsom Cordova, their team has used 50% ELOP funding, 50% special ed early intervention funding to fund a full-time social worker, Mr. Josh. Mr. Josh starts a little bit later in the day, around 9:30, 10 a.m., works during the instructional day, but then continues that work in expanded learning, visiting different sites each day, teaching the youth, all youth, right? SEL, also social skills. And then if there's one-on-one need, he'll pull that child out and do one-on-one, not taking them outside of those instructional minutes, and also destigmatizing the need for one-on-one sort of healthcare, because all the youth at these sites are asking, when's my turn with Mr. Josh? So that's just one. And then another one we sort of uplifted is in our Yuba County, a rural area where the workforce shortage is real in all sectors. Dr. Nina Guzman, who oversees the ELOP programs in Plumas Lake Elementary, listened to the families. What are your needs? What are your wants? What are your desires? And made it happen with ELOP funding, bringing in virtual sort of SEL groups and also sort of one-on-one counseling sessions for students and their families via this online platform. And it's really through leveraging these partnerships and sharing best practices. We're hoping to amplify the concepts of schools as centers of wellness and ensuring that every child receives the support they need to thrive both academically and emotionally. So that's sort of what's moving in Sacramento County at this moment.
Thank you, Mark. It's really clear, right, that the sort of reinforcing this collaborative spirit that that is held by the System of Support for Expanded Learning, and hoping that this is really coming through for folks. But also, right, a clear example of how local programs are leveraging the flexibility of expanded learning funds to make sure that those types of services and interventions can be accessed right all day and all year, and can create that sort of structure that doesn't really put a burden on the school day to reduce instructional minutes. So just really solid. Thank you for sharing that. And just you know, a funny anecdote, I believe that Dr. Josh actually made some announcements at a Friday rally at my son and daughter's school, David Lubin Elementary, to talk about how he would be on their campus every once in a while to sort of help some of those processes. So direct local impact to some of that work. Want to turn to Ernesto Duran. And Ernesto, it's clear, right, that one of the things that needs to be in place in order to effectively create access to resources and services is family engagement. Can you speak to the work that you've been doing as part of the System of Support for Expanded Learning to increase access to resources and interventions by engaging families?
Thank you, Jeff. Thank you, everybody, for the opportunity to talk about the importance of family engagement. I know our role as regional leads is to provide support around compliance, around technical assistance, and that's amazing work that we do. But the engagement component is something that we pay special attention to in our region. We've been working on, or let me just start a little bit with a little history of how challenging it was just to even get a family liaison hired at my county office, because it was kind of a new concept. And I saw the opportunity to really bring somebody from the community to make those, to bridge the gap between families and the system in general. Back in 2005, as a young site coordinator, I was researching best ways to bring resources to immigrant families, particularly in the Ventura County area. And I noticed the engagement opportunities in expanded learning and after-school programs, and saw an opportunity to be more intentional about it through research. And in 2013, I was hired by the California Endowment to do a study on researching mental health disparities among immigrant families, especially indigenous communities from Mexico. And we saw, I mean, the outcomes of the study were incredible. And I thought, when I became a director at the county office, I thought, well, if we were to replicate a similar model in bringing wellness liaisons to expanded learning through the family liaison network that we're working on, it would be great to make that connection. And so I'm using kind of a similar model that that we developed in 2013 through the what we call wellness promotoras. And we thought, why don't we just call them family liaisons in expanded learning? So we have two in our region, Region 8. I think Luisa is connected right now. She's our regional family liaison. And her role really is to bring resources, existing resources in the community that are being provided through community-based organizations or different agencies, and bring them to expanded learning. So she's currently developing a family liaison network. Many of our programs already have existing family liaisons that work during the instructional day, and in some cases in the expanded learning environment. And so we're in the process of identifying family liaisons throughout the region. In Region 8, we support Santa Barbara, Ventura, San Luis Obispo, and Kern counties. And so far, she's identified 30 family liaisons. In fact, we just presented at Mark Drew's conference not long ago, and we were able to connect 3 school districts together to really share the resources that they're providing within their programs, but also so that they can cross collaborate and amplify these resources among the programs, and in some cases the counties. So we're being intentional about that. That's in the process. We're also working internally with, in this case, my county office. We're housed at the Ventura County Office of Education, and we are being very intentional about the work that the prevention department is doing around wellness centers. I think Mark talked about it briefly in their capacity here in Sacramento, but we're also partnering with our prevention department. In fact, we just had the prevention coordinator at our regional meeting present yesterday on resources around substance abuse. And soon we'll be partnering with them to bring workshops to our region around mental health resources. So it's kind of broad because we don't have a lot of time, but I just kind of wanted to give you guys an idea of what we're doing around this family liaison network, because we truly believe that family engagement is crucial, and we want to be more intentional about bridging the gap between our communities and our system.
Amazing. Thank you, Ernesto. And, I think what we are hoping that folks that are participating in the webinar are really getting an understanding of is, one, the system of support for expanded learning is one that if you're looking to partner with expanded learning to support kids and families, that is a system that should be contacted and leveraged, and that they support their local communities in really diverse but impactful ways. And now sort of moving into a site level description or a program level description, right? So thinking of where's the partnership level here, right? This might be with leadership at a community-based organization or a school district, but really wanting to welcome Hannah Cohen to share the experience of the Boys and Girls Club of Garden Grove, partners with the California AfterSchool Network for multiple years on some of our youth opioid response efforts, and just wanting to turn it over to you to share with us your efforts and your program at the Boys and Girls Club of Garden Grove. Thanks for being here, Hannah.
Yes, thank you for having us today. As stated, my name is Hannah Cohen. I'm an associate clinical social worker and director of Boys and Girls Clubs of Garden Grove Truancy Response Program. Brief background about myself is I've been working with the organization for a little over 4 years. And in that time, I've worked with many different roles. However, my work here has always focused on community, from prevention to reactive services. And I continuously see across the board how community knowledge, engagement, and prevention not only can save a life, but it also empowers others to do so as well in moving forward. Next slide, please. So Boys and Girls Clubs of Garden Grove is one of the largest Boys and Girls Clubs in the nation, and we have been on the forefront of providing for the whole child services. Boys and Girls Clubs of Garden Grove, we do have an average daily attendance of 6,000 students and members who do walk onto our sites daily. We also have a large community impact division that is their sole dedication is to serving the whole child through other partnerships in the community. So for over 25 years, we've been providing these mental health services to our youth and programs and community. We've recognized that through the youth, that youth were in crisis and their families did need an additional layer of support. And this was by continuously listening to our families and what our staff on the front lines were telling us, we were able to build out an entire division of resources that effectively leverage community resources and bring them to an undeserved population. So we do have a family resource center that is solely focused on case management, providing food, clothing, and basic needs, along with health insurance, and that they can get what they need. We also have partnerships with our collaborative courts and our county office of education, and that's through our truancy program that I oversee. We established all of this long before COVID. However, COVID enhanced that our mission, that what we needed, we already knew and we were doing. So through our expanded learning programs, we find that it is a trusted hub for these families. And we believe that in order to create better outcomes for our youth, we do have to serve the whole child. We leverage partnerships in the community to bring these resources to the student in order to reduce their barriers. And if we don't address their basic needs first, we can't have a standing long impact for the community or these families who need us most. Next slide, please. And so with this knowledge and understanding, we did join the Youth Opioid Resource Project, creating the pathways for the parents and the youth. We found partners in the community for food, clothing, and health insurance, legal issues, and substance use, just to support that community. Our agency does live in the world of prevention, and we naturally do have the nature to work in prevention and have a high prevalence in that world. We at our sites, we don't see a lot of substance use. However, we know that our youth are impacted through other members, through their family, through community. And with that, we do have an understanding to provide them this information and knowledge. So in order to do so, how did we do this? We first mapped out who in Orange County does have this access and how can we get a seat at a table working with these folks. We aren't your traditional provider in this space, but we had to learn how to be that provider and again, have a seat at that table. We had to educate ourselves, educate the community, and educate our youth with this information. Expanded learning is a huge population that we're eager and willing to participate in because we care and we understand this is a unique situation we have with the community and our members right now. We find that the community truly trusts us since we do have that connection that is very unique. Next slide, please. So most recently, we did have a Narcan training. We opened this up to anyone and everyone in our organization. We found that everyone was very interested in it, and we wanted to provide this to them. So with that, we partnered with our local police department to get real life information. What are they seeing on the ground? And they were able to help us with this training and to train our staff of what they're seeing and how they can apply this to our day-to-day, again, because we are that after-school site primarily. We were able to train all of our site supervisors, and all of our site supervisors did have the option to have 2 naloxone available to them. We do encourage them to have them at site, in their cars, at home, and this is also to educate others in the community of having it, and breaking that stigma, because it can be your neighbor, your grandmother, anyone, and anyone can be affected by this. And this is why we found the need and the importance of educating everyone, even our site supervisors. So since this training was incorporated, we do now include this as a mandatory training for all of our staff when they are onboarded with our agency. We continue to leverage partnerships in the community and to educate ourselves to continue building this process and supporting the community further. And these are just a few agencies that we do continue to work with. Next slide, please. Thank you.
Well, thank you, Hannah. And you know what I'm really sort of hearing from you too is expanded learning programs are a trusted partner in the community, trusted partner for families, and that partnerships between school districts and community-based organizations actually result to some of what Inez was raising in the chat. They result in stronger communities because they have stronger community-based organizations. And school districts also benefit when they partner with community-based organizations because, Hannah, as you'd raised, the benefit of the diverse work and partnerships of that CBO can all be brought to bear on the expanded learning partnership. And just loving to hear how not only are you prepared to save a life on campus, but that your staff are prepared to save a life in the community. What an amazing impact. We did want to share that there are some resources in where folks can learn more about how to access naloxone, how to provide training on naloxone, and that is the Naloxone Distribution Project. Also, just wanting to say that if you want to continue to learn, the best way to sort of stay in touch with us is through getting into some of our newsletters, including our health and wellness newsletter, and then a reminder, of course, that we have the system of support for expanded learning in California, and that you ought to connect with them. And finally, if you want to learn more, there is an upcoming academy beginning on April 3rd about expanded learning. So I'm gonna reference that we do have a feedback form. We'd love to hear your feedback, but we are not done yet. I'm wanting to invite our director of the Expanded Learning Division at the California Department of Education as a sort of reflector to sort of have our last words here. Michael, thank you for being here.
Hello, everyone, and thank you, Jeff, and your team for putting together this amazing last hour and a half. I mean, I'm more deeply informed. I'm more deeply inspired. I'm more deeply concerned. The sense of urgency of all of this is deepened with me. So I thank everyone who shared. I think this is just a rich. I'm so glad it's recorded. I want to take a listen to it, the whole thing again. I hope everyone in this who's participated has the same sense of the importance of our work. You know, as I was listening, I was thinking of one of my favorite authors, Robert Putnam. He wrote Whatever It Takes about the work of Geoffrey Canada. He wrote a really powerful book in 2001 called Bowling Alone, The Collapse and Revival of American Community. He wrote Better Together. He wrote Our Kids in 2016. But one of the things he talks about is the fact that many of the institutions that connect people together in our country are diminishing and degrading. And I think that is only amplified since COVID. I know. We know that our children, for many of our children, the only institution that has the opportunity to connect them is the public school. Yes, there are many other communities. There are many amazing community-based organizations. There are communities of faith. But many of our children, a far smaller percentage of our kids are connected to those types of institutions than have been connected historically in the past. And I think from the Department of Education, it's important to teach kids to read. It's important that kids understand math. It's important, but there are many places in America where there are adults advocating for the removal of social emotional support from our schools as institutions. And what I want to challenge us to is what our children need is a place to belong. And all the things I've heard about today, all the intention, our children need a place to belong. They need a place where they know that there's someone there that cares about them and that they want to come to school because there's someone there that knows them. Not just by name, not just by their scores, not just by their strengths in the classroom or their academic challenges. I mean, they know their hopes and dreams. Our kids need hope. Our kids need love. And our kids need to belong. That's our mission. It's not our job. It's our mission. So that's my reflection, Jeff. Thank you.
Thank you, Michael. As we say, love is a research-based approach. With that, we'll thank you for your participation today. All the recordings and resources will be available, and please do complete that webinar evaluation to let us know how we can continue to meet your needs. Have a great rest of your day.